Ladies and gentlemen, we are in for quite a treat today. Our topic is the top 10 COVID-19 safety tips from the front line of Dynacare. Dynacare, one of Canada's best managed companies right here in Brampton. Our guests today, Donna Pascal and Ben Lenton, have some very, very practical tips for you. I will introduce them formally in just a minute, but I wanted to let you know that this is the second of three very helpful initiatives that the Board of Trade is taking on today, June 24th, reopening day. Happy reopening day, folks. Phase 2 here in Peel region. Restaurants are open, patios, the whole works. This is the second in 3 initiatives that we've been launching in preparation for today. Some of you may know the POST, a program where companies are now, it's called People Outside Safely Together, and our companies are going to postpromise.com. They're fulfilling the short orientation and the pledge that indicates that your business maintains physical distancing. Employees will stay at home if unwell. They'll practice proper respiratory etiquette, like sneezing in your elbow. They'll clean and disinfect regularly, and they'll wash and sanitize your hands. And what that does is that builds confidence for customers, builds confidence for employees that returning to your place of operation is safe to do, and we can get back to full productivity by doing that. And going to postpromise.com, you can fill out the short orientation there and have access to posters and the logo that you can put in your front window, on your employee corkboard, or in your cafeteria as well. Today, we're going to hear top 10 tips, and of course, those of you that have been following the Brampton Board of Trade know that we now have at bramptonbot.com/reopening resources, a lot of resources for you, where to find personal protection equipment, news on reopening. That's one helpful website to you, bramptonbot.com reopening resources. We also have a landing page on all COVID-19 information. That's /COVID19, bramptonbot.com/COVID19. And if you want to hear a recording of this session, go to bramptonbot.com/expert series. In about an hour's time, we will have this session up and ready for view as well. Well, as I say, let's get right to our guest speakers today and this very practical topic. We're so fortunate to have Donna Pascal, the VP of HR and Communications for Dynacare, with us here today, and Ben Lenton. He is the Director of Health, Safety, and Wellness at Dynacare. I'll read the bios of Ben, and Donna's going to kick us off. Ben is the Director, as I say, of Health, Safety, and Wellness. He's been with Dynacare for over 6 years. Prior to his work in healthcare, he's held a number of leadership positions, including roles in HR, labor relations, in the oil and gas sector, also in the transportation and logistics industry. He holds a master's degree in industrial relations from Queen's and a master's of science from the London School of Economics. Donna, as I say, the VP HR Communications. Donna has 20 years of experience, the last 16 serving as a senior HR executive for a number of Fortune 500 companies. She currently leads the HR function at Dynacare, and we all know that it is a leading health and wellness solutions provider. As Vice President of Human Resources, she leads a team of 32 professionals and oversees organizational effectiveness, communications, learning, development, talent management, talent acquisition, and wellness, health, and safety as well. Donna and the HR team are focused on creating an internal culture that inspires employees, grows talent, allows people to thrive at work, and now at home as well. So welcome, Ben, welcome, Donna, and I'll let you take it from here.
Thank you, Todd. It's a pleasure to be here today. I'm very proud to work for Dynacare. Dynacare, of course, being a health and wellness solutions provider with over 50 years of experience. Dynacare is about 3,000 employees, and we are headquartered in Brampton. So very proud to be part of the Brampton community. We have locations across Canada. Around 250 laboratory health centers across Canada, and many laboratories that provide a variety of different diagnostic, forensic, and genetic testing. On a regular basis, we perform about 66 million tests on an annual basis that help to support the healthcare system. We support over 100,000 physicians on a regular basis and hospital systems. We're very much integrated in supporting our hospital network. It's a real honor to also provide, annual support to about 10 million Canadians from a health perspective. So, real pleasure to be here today. And so I'd like to talk to you a little bit about, Dynacare's work in the COVID arena. Next slide, please. So, Dynacare being primarily a diagnostic, that's part of some elements of our wide reaching services that we provide, the diagnostic business being the largest portion of our business. We're very much hand in hand working with various provinces on COVID-19 testing. So currently on a daily basis, we run on average about 21 tests per day, resulting results across Ontario. And then also we support the province of Manitoba with their COVID testing, and also Quebec. Our expectation is that based upon the trends and as we're reopening across various provinces and expanding the criteria for tests, we're projecting about to start doing around 10,000 tests a day to support our medical system with COVID-19 test results. We're also very much working through a clinical testing strategies around serology testing. And that's the antibody test that many people have heard about. The antibodies, of course, are specific proteins, that occur when someone may have been exposed to COVID-19. It is detected through a blood test. And oftentimes when people are tested after they've been infected, they show an immune response to COVID-19. Antibody testing, of course, is especially important for detecting previous infections in people, especially those that are asymptomatic. So our work there continues, and we're working with with the province, and when Ontario opens up and starts that process, we will be there supporting the various provinces with serology testing there. So I'd like to turn it over to Ben Linton, who's going to walk you through about how Dynacare had to respond to COVID-19. Not only as a laboratory, we had to ensure that we kept our operations running so we could support the healthcare system. We also had to ensure that we kept our employees safe. And so we learned a lot through this experience, and it's a privilege today to share some of our tips and learnings with you. So I'll turn it over to Ben.
Thank you, Donna. Hi, everyone. I think as you've heard in the last couple of slides, we're a very science, fact-based organization. And as a result, when we think about health and safety, we also focus on the method of contamination and infection that COVID uses. And we did that purposefully so that we could understand the personal protective equipment and the other strategies that we needed to play out to ensure that this didn't spread within our communities, whether it be patient communities or within our employees. So when you think about the safety precautions that are now common knowledge, back in February, we were really trying to understand, well, what was the cause of the spread? And it really is large respiratory droplets that are coughed or sneezed onto surfaces. Contamination occurs when another person touches their mouth, nose, or eyes, and it's spread through close contact. So when you think about the health and safety parameters around that, it really provides clarity about what patients and what employees need to maintain their safety and their health. Additionally, we use public health guidance and provincial authorities to ensure a fact-based approach for both our customers and for our employees. So as you can see in the diagram, the purpose of the mask is clear when you think about the respiratory droplets. So with that in mind, and now that we have 3-4 months under our belt in terms of frontline healthcare, we're really able to understand what are the lessons learned. And these lessons learned are something that we can share with other businesses. We've divided them out into 3 areas: employee safety, customer safety, and culture and communications. It's important to note that we've also learned the hard way. Dynacare has had 27 COVID exposures and/or positive cases to manage throughout the last couple of months. While this represents 0.1% of our population, it's always a case-by-case scenario. And so here are the 10 lessons that we've learned from a health and safety perspective. Number 1 is invest in training. Number 2 is establish new habits such as hand washing and cough etiquette. Often these habits are not popular and not well established already, and so this is an important change initiative. Number 3 is be aware of practices that can lead to further spread. And this is often good intention. There are good intentions with these practices, and so it's an important criteria to help managers understand, and the science behind it is critical. Number 4 is that customers require direction through visual cues and signage. And so what this means is merely telling customers is not enough. They need the visual connection to what's required as they enter retail outlets, patient service centers. Number 5 is move towards a continuous disinfection mindset. This means that everyone, employees, patients, management, business, has a role to play in disinfection. And we'll also talk a little bit later on about how disinfection is very different to sanitation and very different to cleaning. Number 6, customers are watching and evaluating your safety approach. And so businesses that win at the end of this will be those businesses that have paid attention to the customer and the approach that they've taken to safety. Number 7 is mental health of employees matters, and for that matter, our customers as well. Very often with COVID, we talk about the physical toll, but there's also a mental health toll that perhaps is used as a secondary measure, but also is very prevalent, especially with our employees that are wearing protective equipment day in and day out. Number 8 is protect your workforce through ongoing screening. You want to know that employees that are coming and they're showing up for work are healthy. Use vision and values to adjust to new norms. The future will be different. We're assured of that. And so using the current vision and values to help identify the path to the future is critical. Lastly, listening and communicating reduces safety issues. And so this is clear that safety is a 2-way street or a 3-way street when you factor in customers. And it's incredibly important to listen. It's often a 4-way street because you also have inspectors from the Ministry of the various ministries, the TSSA, public health that are also providing input. So let's talk about invest in training. So here you can see a comprehensive list of the 5 areas that we've paid attention to and that have been most impactful for us. The first is wearing PPE properly. It's all very well to wear a mask, but contamination occurs mostly when there's a false sense of security around wearing the mask and when you put it on and take it off. Cleaning and disinfection requirements. We'll learn a little later on that not all disinfection is the same. And that there's also a role that the employee and the customer plays in disinfection. It's not meant to be left up to cleaners or to third-party cleaners that are coming in and out of your workplace. It's a role that everyone needs to pick up. Customer interaction is critically important. So we can look after our employees, but not at the expense of our customers. And so developing customer and employee protocols and policies, including de-escalation techniques, is critical. Customers do not like waiting in line at the best of times, especially in pandemics. And we've learned that the hard way as well. And it's important that our employees are well versed in dealing with the psychological toll as well as the physical toll. Personal safety is very different to wearing personal protective equipment. And really, from an employer perspective, it's around staggering breaks and lunches, encouraging hand washing, establishing directional signage, and other such programs. And then lastly, training is around the COVID-19 basics is incredibly important. How it is spread, what you can do about it, what are the myths, what are the truths, is something that our employees have lots of questions on. And there's also a lot of myths about the different ways that you can catch it. So here's an example of one of our job aids, and we've got an appendix at the back of the presentation, which we'll be sharing with you later on, that has all our training materials on it. So feel free to use these as you wish. I chose this job aid because many people think that putting on a mask is the best approach to tackling COVID. And while it is, it's also critically important to know that when you put a mask on, you can't touch your face. You can't fidget with the mask. You have to discard the mask appropriately. And so there's a number of parameters that should also think about. So putting on and removing a mask is not necessarily as simple as just as some of the public may think it is. As a healthcare institution, we pay particular attention to this and are happy to pass on some of the lessons around it. So there's a lot of debate out in the public around procedural masks versus facial coverings. So what we do when we're asked these types of questions is, what's the science? What are the facts behind procedural masks, and for that matter, facial coverings as well? So in our facilities, we not only allow medical masks, but we also allow non-medical masks, bandanas, scarves, even cloth that is tied around your nose and mouth. Because if you think about the science behind this, it's large droplets that come out of your mouth, placed onto a surface, and then are picked up through the eyes and mouth and nose of another person. So for non-healthcare workers who are able to physically distance, facial coverings versus procedural masks are sufficient. There's no requirement for N95 masks. So there's been a lot of debate about that in the news, and you very often see people walking around with N95s. It's absolutely not required. N95s, for instance, are used in hospitals, but also for asbestos removal and other trades removal. In hospitals, they're used when artificial respiration is used. So this is when tubes are inserted into the throat and deeply into the lungs. And so the aerosol that's generated as a result of that requires this protection. You'll see on the right-hand side the difference between an N95 and a procedural mask. In business and in commercial settings and in healthcare settings, to wear an N95 mask, you actually need to go through several hours of training. So for people to buy it, for instance, at Canadian Tire and just put it on their face, they're wearing it inaccurately. And so a procedural mask is much better because it's more flexible. New habits are incredibly important. And if one message that you take away from all this, it's hand washing and hand sanitization as the key to patients and customers entering your locations and your employees staying safe. It's also important to note that not all hand washing is equal. And so you see on the left-hand side that every mirror and every sink at Dynacare has this 20-second symbol. 20 seconds is a critical amount of time because it allows the individual to wash both sides of their hands, behind their nails, etc. The general hand washing that's 2 or 3 seconds really isn't doing much good. It makes people feel better, leaving washrooms as an example, but from a sanitization perspective, it's not adequate. So it's, for us, the key lesson here is that the customer has to see the employee practicing hand sanitization between each patient. In retail sectors, as an example, customers would want to see constant hand sanitization, and it's something that needs to be observed. So time and time again, we tell our customers, yes, we practice hand sanitization, but until the customer sees it, there's an issue. And so that's a really important takeaway from what we've experienced over the last couple of months. It's also important to note that not all hand washing is equal. So I'm not going to go through this in any detail, but it is in the deck in the presentation. It's really a 5-step process. This is incredibly important for us in healthcare because we're actually audited on this process. An inspector would come in and watch employees wash their hands using this manner. So while you may think, well, this is extensive, it's actually a process that's used time and time again for disinfection. I can't encourage enough the importance of washing your hands, getting your customers to use hand sanitizer before they enter your locations, and then also for employees. So let's talk a bit about hand sanitizer because it is the hot topic of the day. You can go into Walmart, you can go into many different stores and not find any of it. Recently, you will start to see an increased supply. So hand sanitizer is a good substitute for soap and water, but soap and water is the best. Soap and water actually washes the virus away from your skin. Hand sanitizer used incorrectly dries the virus onto your skin. And so it's important that it has at least a 70% alcohol component because as it dries the virus to your skin, the alcohol component kills the virus. Anything less than that leaves the virus alive. The contents of hand sanitizer are beginning to change due to shortages. And this is why you'll start to see a really big or a large supply of sanitizer being restocked on the shelves. It's because the alcohol that's usually a large proportion of the hand sanitizer, the isopropyl alcohol, is being exchanged by ethanol, which is a technical grade or a lab grade alcohol. So what you'll see over the last couple of weeks is that as you go into stores and retail, the sanitizer that you're using is slightly greasier and has a different smell. And it's because the true grade alcohol is being exchanged. As a result, you would have heard in the news, some of these items are being recalled because of this. It's just a cheaper version, and therefore it's more accessible for the general public. So the other thing that we've learned is that best intentions can often lead to additional spread. And so I just wanted to walk you through some of the best intentions that we have, or that we've seen with our managers that have led to additional spread. The first one is that managers want to boost morale by holding on-site team meetings of 5 or 10 people. In this case, it's much better to do it virtually if you can. The second one is you see the individual with the mask below his nose. Employees often are feeling hot and therefore don't want to wear the mask or don't want to wear the face shield. So often managers thinking, how to boost morale is, well, why don't you just wear it below your nose? This is incorrect, and what it does is it it creates a false sense of security around that individual. Employees also bring in unwrapped treats to share, and really the new norms in the new working world. Unfortunately, sharing a pizza or a box of donuts becomes more complicated and really should be offered individually. In downtime, managers decide to complete non-essential training, bringing people together, which could encourage spread, as well as office workers deciding that they prefer to work in the office than at home, and as a result, go into the office without an essential reason. Additionally, employees carpooling, of course, saves costs, reduces emissions, but remember there's a 2-meter distance there that often is impacted by the carpooling. So these are just some examples of where you learn the hard way. Let's talk about visual cues that are needed for customers. What you see here are a couple of examples that we use in our patient service centers. And you see these similar signs in retail outlets enough as well. And what we've realized over time is just speaking to the customer, the employee is not enough. And the need for visual cues is incredibly important. So on the left, you see the 2-meter distance rule. The footsteps are really where we expect employees to stand. So we have these in front of microwaves, in front of fridges, in work areas that require people to be on an assembly line. And it's meant to promote that concept of 2 meters. We have room capacity signs and also screening signs around health at the front of each of our entrances. There is in the appendix at the back, there is a list of suppliers that can provide you with this type of signage. We've decided to brand ours, but in other areas, in other organizations, there are also generic signs similar to this. The concept of continuous disinfection is a journey. Cleaning, sanitization, and disinfection are very, very different things. And in the healthcare world, and I think in the new world as it pertains to COVID, our customers and our employees want to see active disinfection. Active disinfection is when you use Health Canada approved substances. We use something called quat, bleach, and hydrogen peroxide. For disinfection, this needs to be glistening wet for at least 3 to 5 minutes on the surface. So a peripheral wipe down of a table often results in cleaning and sanitation, but not disinfection. So when you think about complete elimination of COVID, which is very difficult, it's the solution on the tabletop glistening wet for 3 to 5 minutes. We've also worked on sign-off documents for our high-touch areas, and we also have a safety data sheet of all the chemicals that we use. You don't necessarily have to have this, and so small employers actually use online substitutes. The other thing that we've done is we've worked with our joint health and safety committees on an infection and disinfection checklist. And these are all very simple solutions that any business can use. So please feel free to use this chart in your own organization. Let's talk about the impact on the customer. It's been profound for us at Dynacare because often our customers have just received bad news or are worried about their test results after a doctor's visit or have some immunocompromised disposition or are merely waiting with elderly relatives or family members. And so time to serve is incredibly important to us. So in March, our time to serve was very, very different to June. In March, nobody was going to the doctor. Nobody was getting tests. It was really a lockdown situation on people's health. That has changed and it's now opening up, which is creating a difficulty for us because as we maintain physical distancing, long lineups are occurring, often past other retailers. So let's talk about March. In March, we admitted customers that passed the screen only. people that failed to screen, so do you have symptoms, have you traveled, would not be admitted by us. Employee screening occurred at the door, and that, together with disinfection of equipment, the 2-meter rule, and employees continuously taking on and taking off PPE, there was about a 25% increase in time to serve. We had to change this and we had to be innovative. So there were a number of things we did. The first thing we did was we started to increase our volumes and admit all customers, whether they passed or failed our screen. We've now asked all customers to wear masks when they enter our facility. Often we're dealing with immunocompromised and elderly individuals. Screening at the door has changed from asking each individual a series of questions to asking the customer to read the signage. Together with that, we've introduced technology to register customers in advance. And so we've automated a text messaging system where the customer can wait their turn in their car or on a park bench and not have to wait in our waiting room or in front of our doors. We're very proud of this as an example of something that allows us to manage our customer expectations, but also manage the safety components to COVID. The last couple of slides really talk about culture and communications, and the mental health toll is as significant for us as the physical toll is. Large organizations have EAP providers, and so we've maximized our use there. But over the last couple of months, we've found incredible online resources and government resources that are that provide tremendous opportunity to employees and customers that are dealing with the mental health toll. A couple of lessons we've learned is that it's not just about the employee, it's about their family as well. And their family often is suffering, in isolation or in lockdown, or because their job has been affected by COVID. The resources and training that are online are all in our appendix and are really tremendous. So outside of the COVID pandemic, employers would be spending considerable amount of money on these resources because they would have been private pay. The government has opened many of these resources up, and I can't emphasize enough the importance that this has played with us, and also the fact that it's free allows everyone to utilize it, and it's very accessible in many different languages, etc. The return to work process itself. So our CEO and Donna and others have asked us to think innovatively about our future. And so this means a number of things for us, but I wanted to highlight two of the concepts that we're looking at currently. The first is attempting to become digital around this versus paper-based. So for our employees, there are two items that we're looking at. The first is a fever detector. So there's technology out there that allows us to screen in a more appropriate way employees, whether it be now, whether it be during some second wave, or even just the traditional flu season that will become mixed up with COVID come November and December. This screening technology, as an example, allows an employee to look into the monitor, and it's connected to our automated security door that, together with a pass card, allows them to enter. The other thing we're doing is the screening process that we talked about earlier on is really a passive process, and we're converting that to a more automated process where people, employees, and for that matter, independent contractors or any visitors to our location can click on a link, answer the questions, and then through a text messaging process, notify people of a pass or fail with regards to their health index. One of the final slides is really about communication. However, communication is critical throughout this process. And although it's one of our final slides, it should be right up there at the front. Because what we've found is that with communication to our joint health and safety committees, to our customers, it really manages expectations. And so if you have an opportunity to communicate, please use it. Listed here are 5 specific areas that we've spent time on communicating that have worked impactfully for us. The first is provide written safety guidance. So is a mask required? Is it not? How are we reassuring our customers and our employees about disinfection? Illness and staying home. Be really explicit about when you want an employee to come in, when you want a customer to come in. Otherwise, often we get examples of, well, I'm good-hearted. I want to help out. I have a slight cough. I think I can come in. And this sort of really impacts both the employees and customers around that person, but also reduces our ability to understand the context and the spread. Proactive customer messages are increasingly important. We use our website, we use something called an EMR, and we also talk about simple things like hours of operation, but also expected behaviors from our customers and from our employees. Additionally, escalating safety issues. So who do I ask questions to and when? Don't let questions from your customers or questions from your employees fester, because often what happens is they turn away, they go home, they don't come into work, or they don't come in and receive the service that they need. Often what we've done in an excellent way is write down the day-to-day questions and answers and be transparent around them. And then lastly, really communicating in a transparent but confidential way the employees and the customers that are exposed. And so how do we do that? We do that by defining when those individuals have to self-isolate and when they have to self-monitor and what the difference is between the two. Lastly, the norms are incredibly important to adjust to our new reality. And so we have new norms in our workplace that are listed on the right-hand side. Perhaps the most important for us is be kind, act with compassion. This is both important for a return to work from an employee that is scared about bringing the virus home to his or her elderly relatives, all the way to customers that have to wait in line and often are immunocompromised in doing so. The new reality of the future, I think, is with us now, and how we act now will really impact how our employees and our customers perceive us in the future. So thank you very much. It's been a great honor to walk you through these top 10 tips.
Thank you, Ben. I hope you found the information that we've shared today helpful to you. We were thrown into the pandemic like many companies, and under those kinds of circumstances, it's amazing how, as an organization and as people, that we can thrive and overcome challenges. You'll find this presentation at the end of this presentation. We provided a litany of information, websites, and helpful training tools for you to be for your use and support of your business. But thank you for the opportunity to share our learnings with you today. And I guess we'll open it up for questions, Todd.
Yeah, that's great. Thank you so much, Ben and Donna. Our first question comes from Joanne. And in your presentation, you mentioned the point of antibody testing. You mentioned the Ontario government may soon roll out this testing to the community. The question is it possible to access this form of testing, antibody testing, for a fee at Dynacare or anywhere else in advance of the Ontario government rolling it out?
Todd, I can share with the caller that we will work, typically we take our guidance from the province, and at this stage they have not provided full guidance on how they'd like to see this rolled out in the community, and until that time it is not being offered as a private service. Once we do have that direction, Health Canada has approved a number of different serology tests. Once the provincial government has decided how they see the clinical utility of that test, we definitely will be there and probably could answer a little bit more directionally what we can provide to the community.
Great, thank you. The second question is a technical question with respect to ethanol and isopropyl alcohol. Is ethanol at 60% as effective as isopropyl alcohol at 70%? We're referring to sanitizer.
I can answer that, and the answer is no. They're both roughly the same in terms of their kill rate for coronavirus or COVID-19. They're really just substitutes one for the other. So when we look at our supply chain and our requirements around this, we're looking for 70% on either substance.
Okay, very good. Our third question comes from Panajata. Our HVAC, winter and summer, doesn't seem to circulate air very well. It doesn't work all at its best. Do you suggest getting an air quality test?
So yeah, no, that's a really good question, and we've been talking about HVAC for a while. Many organizations are using UV light. They're using different types of filters. They're changing the airflow, the fresh airflow. Really, none of that is proven scientifically. So if you go back to the facts, we're really fact-based. So there's really no guidance from Health Canada or elsewhere on HVAC and requirements around it. So what we've decided to do is manage the HVAC like we always have, but changing our filters more appropriately. And HVAC is really important to healthcare because the circulation of our air already occurs 7 times greater in our labs than it would in a regular retail outfit. So to answer that question, I really think you need to look at it from a case-by-case basis, get an expert in to look at it, look at the guidance, and it really is something that is individual to each unique situation.
Thank you very much, Ben. We've had a number of questions from folks asking about the slides. I just want to remind people that yes, Dynacare has been very generous with their time today and their provision of resources. These slides will be available this afternoon, let's say before 5 o'clock, at bramptonbot.com/reopening resources. Others have asked about accessing this recording. Yes, we will have that available for you this afternoon as well. Again, bramptonbot.com/expert series. That's where the recording will be. The slide deck will be at /reopening resources. At the expert series landing page, you'll find 20 expert series, expert interviews like we've done here today. One's on cash flow, one's on interpreting federal aid programs, one on scenario planning, and some really cool dashboards to help you plan your reopening investments, your rehiring, etc. That's all at bramptonbot.com/expert series. We are heading into the last few days of June, and that means the deadline for nominations for the Business Excellence Awards closes on Tuesday, June 30th. If you know of a supplier or a customer that's provided outstanding service, there are 12 categories for our Excellence Awards this year. It'll be October 18th. It's going to be this really super exciting virtual awards program, just like the Oscars. It's going to be awesome. You can nominate someone until Tuesday at bramptonbot.com/BEA2020, BEA 2020. Ladies and gentlemen, thank you so much for your attention today. Thank you to our panelists, Donna Pascal and Ben Lenton. We really hope that we see you again for one of these expert series or in one of our networks. July 7th, our Talent Network meets. July 9th, our Goods Movement Network meets. The 13th, our Civic Leadership Network meets. And we've got some other great expert interviews and business insights. 21st on cash flow, and our AMA at the end of the month, the 28th, Ask Me Anything. That is an Ask Me Anything AMA with Mayor Brown and our chair, Vanessa White, the Chief HR Officer at Maple Lodge Farms. Wow, thank you so much for these very practical and helpful tips. Donna, it was amazing as always. I should have mentioned Donna is a director on the Brampton Board of Trade and just provides us with stellar advice always. Ben, thank you so much for your preparation today, for articulate presentation and your resources as well. We'll have this all up on our websites for you. Thank you for your attention today, and we'll see you again soon. Happy reopening day. Bye, everyone.